The element of heat, it can be a good thing, like performance recovery for athletes, saunas, or it can be a bad thing as an extreme heat or dangerous dehydrations. So how do you make sure it's your friend, not your foe, for your health?
Welcome to Healthy Living, Wellness and Prevention, Medical Innovation, the informed side of care. Welcome to Baptist Health Talk.
Welcome to a new episode of Baptist Health Talk, where we answer your most searched questions on the internet. Today's topic is when heat is your friend or foe to your health. I'm Willard Shepard, your host for today. Now, to talk about this, we are joined by Dr. Maria Kyriacou, primary care sports medicine physician at Baptist Health Orthopedic Care, and Dr. Leo Huynh, chief of emergency medicine at Baptist Hospital of Miami. First of all, thanks to both of you for being here. And before we dive into this, we want to let people know out there and remind you and our viewers to send in your questions and comments in the comments through this discussion. And we're certainly here to help you. Very happy to answer any of the questions many of you may have out there. So first of all, thanks to both of you again. Let's start out with Dr. K, as you've given me permission to call you. When it comes to heat, when it comes to performance, recovery from athletes, whether you're a professional, weekend warrior like myself, is it our friend? How should we handle this? What should we do? And especially when it comes to saunas.
Absolutely. So yes, heat can be your friend, but certainly it can be a foe. When it comes to our athletes, you hear a lot of them going into the saunas or a jacuzzi versus the cold water. One of the benefits that we have when it comes to having that temporary beneficial effects from heat, it does increase your circulation. In some sense, it almost feels like you're exercising. It's at a position where you're having increased moderate exercise. So you're increasing your heart rate, you're increasing your circulation, which is beneficial in terms of the healing process of when you've had an intense activity to the muscles. So one of the things that actually happens is you're increasing the release of oxygen from your cells, from your red blood cells, and that allows for proper healing of muscles and allows for the removal of this lactic acid that you build up. It's a relaxing benefit as well. The muscles are relaxing. It helps relieve some of the stress that is involved with an intense exercise. But yes, it certainly can be a foe. One of the things that happens, especially when you're in a sauna, it's increasing the core body temperature. So how do we release this heat? We sweat. But when you're releasing heat, when you're sweating, you're losing your electrolytes. You are becoming dehydrated. So it should only be a short period of time. If it's too long, you can potentially have dehydration, and you can increase your temperature to the point where the body can no longer regulate it, and that can have some detrimental effects.
Okay, Dr. Huynh, as terms of these being safe now, she was talking about the benefits. What do we have to be careful about? How long should we stay in the sauna? And when should we avoid this altogether?
Thank you, Will. To echo what Dr. K said, I would say in moderation it has benefit. Somewhere around 10 to 15 minutes, I think, is reasonable. I think you have to understand, if you're acclimated, if you're new to saunas, and you might want to ease into it and start with 5 minutes. Certainly the patients and the athletes that use it, be cautious with the elderly, obviously. Certainly patients that are on blood pressure medicines, antihistamines, and even psychiatric medicines. Never want to mix alcohol and using a sauna. Those type of patients will be a little bit more risk for the dehydration and electrolyte abnormalities.
What about this new technology, an infrared sauna? And it's on the market. What about that?
So the difference between your regular saunas from an infrared, regular saunas actually utilize the air. They heat up the air, the atmosphere. As opposed to infrared, you're actually using the far end of the light spectrum where it heats you directly without having such a high temperature in the room. So it's a more easier way to have someone acclimate into a heated temperature, a heated room. So it's not directly the room itself, it's you that's heating up. So it's increasing your core body temperature. And for some patients, they find it a lot friendlier as opposed to the more humid saunas.
You're up at the state-of-the-art facility that the hospital has right next to Hard Rock Stadium and the Dolphins. So the technology that's there and a lot of these ice plunges and the cold temperatures, what are the benefits of that? You know, the Dolphins and other football teams about to start two-a-days where you'd see the players in an ice tub just jump in with all of their gear on. You've brought this a long way from there.
Oh, absolutely. So yes, cold plunges, they do have benefits, but again, you want to ease into it. In terms of our athletes that are doing it, there's a lot of beneficials in terms of it helps with inflammation in the body. You know, cold in itself is an analgesic. It helps reduce inflammation, has more vasoconstriction that occurs to your blood vessels when you're in the cold. So reduces increased circulations to area that might be currently inflamed. Again, it triggers this more parasympathetic response. So it helps them relax. It brings down their blood pressure. But one thing that first happens is you get that shock, that sympathetic response, and that can be very dangerous to somebody that might have a cardiovascular issue or an arrhythmia issue. So you always want to make sure that you speak to your physician first before you do anything that is a cold plunge.
We're talking about high-performance athletes, but for the general public, what would you say about taking their body and reducing the temperature in such a rapid manner? And those of us that participate in athletics who are amateur athletes or people just out walking on a day like today here in South Florida, what would you say about reducing their body temperature like that?
Absolutely. So it's always good to ease yourself really into anything, to sports, to any kind of new therapy, whether it's thermal therapy or cold plunges. You want to ease yourself. So usually what I tell patients is first start with a cold shower. It's not something that you go immediately into. Make it nice and cold. Give yourself about 20 seconds of slow breathing, because that way that allows you to acclimate yourself to a plunge down the road. If you go too quickly into it, again, you can have more of this shock sensation. Some patients can even become what's called vasovagal, where they immediately dilate their blood vessels and they can have a syncopal episode or they pass out. So you want to do things slowly and gradual. The more you become comfortable with that cold sensation and you can control your breath, that's a big one. Slow down your breathing, then you'll be more prepared for that cold plunge.
Dr. Huynh, on the other end of the spectrum, a heating pad, kind of old school kind of remedy that a lot of families would use. What about that, and where are we today with using that kind of treatment?
Yeah, I think with heating pads, I think there is some benefit, probably more in the subacute phase, meaning if you work out and maybe had a big workout or just starting out and the next day you're very sore, I think heating pads do play a beneficial role just as far as increasing blood flow to that local area. I would use caution for the electrical heating pads. You don't want to fall asleep. You feel rested, you're trying to warm the muscles up and you fall asleep with the electrical heating pad. It can lead into some thermal injury. So I would just use caution and limited benefit. And I would say in that subacute phase, after a heavy exertion, you're feeling sore.
So when should we use heat and when should we use ice?
Yeah, it's a never-ending debate, obviously. And in the acute phase, I think ice is very beneficial. So if you had a really heavy workout, it's very similar to an ice plunge after a big workout, adds a nice anti-inflammatory effect. You see those pitchers that have all their joints and iced out after a game, and in that acute phase, I think it's beneficial. And the heat, again, if you're sore the next day and you're trying to you have a hard time moving, did squats the day before, I think using some heat can be helpful in that situation as well.
What are your thoughts about when we should use cold treatment versus hot treatment?
I completely agree with you. Really, it's at the end of an exercise. You want to bring down that inflammation. Cold is an excellent source of an analgesic or reducing that pain, that inflammation. And warmth, that helps increase circulation. So removing that lactic acid buildup. That's why you see them doing both hot and cold. But yeah, at the beginning of the day, when you first wake up and you're feeling that muscle soreness from that intense workout, That's an excellent form of reducing that soreness, is that warm compress. Even with my patients that have chronic pain, such as arthritis, that's also another recommendation. First thing in the morning, putting a nice warm compress, it loosens the muscle, it loosens the fluid in the joint as well, and makes the experience of maintaining that activity more pleasurable.
Okay. In terms of a scalding hot shower, not to burn yourself, but just short of that, what are your thoughts about the benefits of that? Or is that something we also need to be careful about?
I would caution more on the side of be careful with it. A scalding hot shower has some concerns of thermal injury. But again, if it's not too scalding, somewhat the same benefits that you're helping loosening the muscles up. It helps relax, increase your circulation. So we're relaxing the muscles when we take a nice hot shower, but not too hot where you're going to burn yourself.
Okay, I think I know the answer to this question, then that is going to be water is our friend, especially here in South Florida. Incredible heat, obviously, global warming becoming more of a factor here. What about the signs of dehydration and preventing it?
Yeah, so I think understanding yourself, understanding the situation is very important. Early signs, you'll start to feel dizzy, lightheaded, some cramps. And then, once you recognize that, excessive sweating, you really have to get yourself out of the situation, get yourself out of the heat, actively cool yourself down with water and even ice to cool you down. Just get out of that situation. Because the early signs of heat cramps and heat exhaustion are, I think we all experience it when we're outside. I mean, during that mid heat, but once you're out there for a prolonged period of time, and then your temperature reaches like that 104 range, and then you start dealing with heat stroke, where you can faint, become altered, and it becomes a medical emergency at that point. So you really want to recognize it early when you feel those early signs.
Tell us about drinking water, drinking enough in advance. How much water should we intake here on just a regular day in South Florida?
It really depends. If you're outside, you could have a tremendous amount of fluid loss. So your body has a really good regulation of how much you intake. So it could be upwards of the typical, you hear the 8 glasses of water per day, but it could be even twice, even 3 times the amount if you're outside for a prolonged period of time, especially if you're doing work outside. Certainly, us golfers, we have to really stay hydrated and stay ahead of the game.
He touched on this going as far as heat stroke. What are the specific symptoms of that, and what type of immediate action needs to be taken?
Yeah, absolutely. So the first thing you want to recognize, like he said, is the signs of dehydration. And so one of the things that we tell our players, our athletes, is as soon as you start to notice that, hey, I'm feeling thirsty, you're already in the spectrum of you're dehydrated. So you want to be very aware when you're starting to have that sensation of my mouth feels dry or I'm feeling thirsty. Once it gets to a point where we're hitting the heat illness or heat exhaustion, like you said, you start to feel the cramping of the muscles, you start to get a little bit lightheaded and dizzy. And so you immediately want to get yourself to a cool area, a shaded area. When it gets to the point of a heat stroke, that is, you're almost at a point of it can be catastrophic. It can be fatal. So what we do for our athletes, we actually have during our football season or when we're out there in the heat, we have an ice bath where we immediately put them in. We're checking their temperature every 5 to 10 minutes. We have ice in there. We're circulating the water. Obviously, this is something in a more professional level that you see this, but trying to emphasize the importance of you want to reduce that body temperature if we're at a state where it's concerning that we're at the heat stroke level. So you never want to get to that point. If you start to feel you're thirsty, I'm feeling lightheaded, dizzy, I'm getting cramps, immediately get yourself to a cool area and start to hydrate.
How often, unfortunately, do you see people come in with this type of heat-related symptom?
It's actually pretty frequent. Most present with dehydration symptoms and electrolyte abnormalities. Most of it is weakness and lack of energy. The populations at risk, again, are the elderly and the infants. They don't regulate their temperature as well. And certainly the patients that, are on psychiatric meds and they don't realize that their temperature goes up. The patients on beta blockers in particular, which they don't have a, good sweating mechanism. And something simple as like Claritin or Zyrtec antihistamines. You take for allergies. You can't regulate your temperature as well. So those patients are a particular risk, and they come in, but typically we could turn them around with some IV fluid and correct their electrolyte abnormalities. Rarely we do see the heat stroke, and we approach it very emergently, really trying to get that core temperature down quickly as possible.
Final tips from you about how to stay safe, especially this time of year.
I would say just know yourself, understand yourself. If you're someone that's outdoors all the time and is exercising every day, then you know yourself. If you're going on a hike with friends and you don't hike and you're in midday in South Florida, you can get in a very dangerous situation. So prepare, understand your situation, stay hydrated, and stay cool. Be smart about it.
Okay. And your final tips? Well, we have a golfer with us. He's a golfer. So do you advise a hat, some sleeves to protect from the sun, those types of things?
Yes, absolutely.
What about that?
Yes, you want to make sure that you wear clothing that is wickered. So basically that it evaporates a lot quicker as opposed to the more thick layered material. Make sure that you protect your skin. I know a lot of people out there, especially in the Miami, we like to sunbathe, but practicing sunbathing actually has a negative effect in proper sweating. So allowing your body to cool down. So you want to protect your skin. You want to make sure that you're wearing long sleeves. Another important thing to appreciate here in Miami is it's very humid. And when we have high humidity and it's also hot, that also doesn't allow for you to properly cool yourself down to sweat. And so your body core temperature starts to increase more drastically than somewhere that is a hot, dry area. Usually what I recommend to both my athletes as well as my patients, when you're working out, best time to do it is early in the morning or later in the evening, not when it's the sun is at its highest and it's at its hottest. Okay.
Quick question for those of us that love the Canes and love the Dolphins. Is it an advantage to have the Patriots come here and put on a dark jersey in September?
Yes.
Good idea.
Good
okay.
idea.
Thanks to both of you. We really appreciate that. Great conversation. Thank you for sharing this insight with our audience today. And remember, viewers, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. And as always, thanks for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.